a bit of the theme is, where is technology now? Where is it heading? How do we think differently about reimagining and rethinking and redoing how we practice health and medicine? It's not just the future of the hospital. The future of the hospital may not be the hospital. We're going to hopefully have the opportunity with new mindsets, the entrepreneurial energy here in Bulgaria and beyond to really create that future. So it's a very exciting time, and all of you can play a role in creating that future. As we heard from our friend from IBM in the very great first talk, we're really not where many other fields are. We're stuck between maybe the third and fourth industrial age in terms of shifts in healthcare compared to what we're doing with banking and entertainment and mobile. And sometimes in our experience of healthcare, it feels like we're still a bit stuck back in the future. I went to medical school at Stanford. I trained at Mass General Hospital. I'm in that picture there 20 years ago. I went back to visit Mass General last year. 20 years after I was trained there, the ward where I spent my first month, pretty much unchanged in 20 years. They're still using the cutting-edge medical communication tool of our day, the fax machine, to communicate. Cutting edge. And so now whether you're in Sofia, in San Francisco, in Mumbai, we're still, in waiting rooms, waiting an hour for the visit. Sometimes it takes months to get the visit, to see a doctor for maybe 12 or 15 minutes. So we need to reimagine healthcare out of the buckets and silos that we've created over time, even defining it outside of the often bucket of body parts as we've defined healthcare in the past, because we're now in this connected, genomic, digital age. So our challenge is to move to true healthcare from what we really do today, which is sick care. What do I mean by sick care? Sick care is our model today where each of us and our patients get very intermittent data. You might go to the clinic or the emergency room, you get a blood pressure, an EKG, maybe some labs done. That happens usually only in the four walls of the clinic. Maybe you have high blood pressure or diabetes. Maybe you're writing down your numbers and sending them to your doctor by fax or by PDF, whether they want to see them or not. So intermittent and episodic data leads to a very reactive sick care system where we wait for the patient to show up with a heart attack or a stroke. Or I'm a cancer doctor. Most patients present with their cancers at late stage. And I think our opportunity with many of these digital and other technologies that are coming to age is to become much more continuous with our data, make that real information, make that proactive, preventative, and enable us to practice healthcare anytime, anywhere, even for much lower costs with much better impact. And as we heard already about living forever, I think it's not about living forever. No one wants to be 150 and not able to think and talk and move. We want to have health span, not just lifespan. Okay, so I'm going to quickly cover the arc of where we are with health and wellness, diagnosis, therapy, and even discovery. How can we all play a role in the future of medicine? Because the future of medicine's on everyone's minds. This is the cover of National Geographic in January. I had the honor of writing the opening article. And they changed the title on me. I didn't really make that title. 12 innovations that will revolutionize healthcare. It's not about any one innovation. It's how they're coming together. And many of these innovations are moving quickly. Some of them are, epitomized by our smartphones becoming a medical device. This is an example of an exponential technology. Moore's law, the power of computing, getting twice as fast at half the price about every 18 to 24 months. Exponentials are all around us. That's why the technology of the 1980s and 90s is all dissolved and appified. It's basically free. You don't buy a GPS unit or a video camera anymore. It's in our smartphones. And that's starting to come, to bring healthcare to everyone on the planet. 3 billion more people will get internet access in the next few years. That has huge applications for markets and healthcare. So you need to start thinking exponentially. 30 exponential steps is actually 1 billion. That would be 26 times around the planet. And that's happening with many technologies. It's a bit deceptive, exponentials, right? Where are we here? Where are we going? Think about it. It's only been 12 years since the first iPhone, 10 years since the App Store. Twitter launched 12 years ago. Airbnb was a mattress company basically 10, 11 years ago. So the world is moving quickly. Our opportunity in the next decade is only going to accelerate. So what can we do today? With our magic smartphones, we can compare one hospital to another. We can rate doctors and healthcare systems, compare drug prices, look at surgical scorecards, how surgeons are doing in individual procedures. I can rate Shafi compared to another surgeon, whether he likes it or not. So as consumers now, we have a lot more power and information. And again, that's riding on our smartphones, which are not just for communication, but are starting to become FDA-approved medical devices. I'll show you some examples. So on this exponential curve, what used to fit on your desktop now fits on your Apple Watch. And now the Apple Watch is an FDA-approved medical device. You can do your EKG on the watch, and it's just the very beginning of what will be living on our watch. We're now in an era where the computers are the size of a grain of rice and have the memory and speed of my Apple Watch or laptop, and they're becoming connected. You know about the Internet of Things. That's quickly moving to the Internet of Medical Things, the Internet of the Body, the Internet of Health. And now, as of this year, riding 5G, which is up to 100 times the speed of 4G. So if you're building a new healthcare solution, think about building for 5G or maybe even 6G in this new era of Internet of Things. And this is moving so quickly that, just 2 months ago, the first 5G surgery was done in China. So soon Shafi will just stay at home in his pajamas and do operations from his tablet. It's moving that quickly. So the challenges, of course, now, all these new
Dear
Internet
diabetes.
things and technologies are creating massive amounts of data, which are often very siloed. The medical systems in the United States don't talk to each other. The data on your phone is siloed to you. How does it flow to your doctor? How do we connect our genomics and our digital exhaust? How do we move from data to information to actual clinical utility that you or your doctor or your healthcare system can use? Huge challenges in closing that gap. And technology is only a part of it. Actually, much more important in many places are the incentives. How do we pay for things? In most healthcare or sick care systems, we pay for disease. We pay to treat advanced elements. We don't pay for prevention or for health or health. We pay for sickness. We're starting to see the equation shift, paying for keeping people healthy. And also keeping people out of the hospital. The incentives are now not to come into the hospital or the clinic, but to bring healthcare from the hospital to the home, to our phone, to on, and even inside our bodies. And that means where we get healthcare is changing, from our corner pharmacy to our mobile app. So a lot of this is now a bit buzzwordy, right? Connected health, mobile health, digital health. I think we'll just soon call it health. But we do have the ability now to connect the dots in new, powerful ways and to rethink healthcare. And I love the comment earlier, we don't want to digitize our current system. We need to reimagine it in whole dramatic ways. And that means bringing together many technologies, not just mobile, but virtual reality, augmented 3D printing, synthetic biology, AI, big data, all converging to blend what we need in technology and healthcare to create entirely different fields. The kind of the middle, computational biology, designer drugs, telemedicine, all are this convergence of technology and healthcare. So with these new powers, these superpowers, we have the opportunity to address challenges we have in Bulgaria, in the United States, everywhere in the world. We have challenges with rising costs, aging populations, as you just heard, access to care, a shortage of doctors, nurses, surgeons all around the world. We have the challenge of too much data. We want information that's not sent by fax machine. And we also have the challenge of our policymakers, our regulators, thinking of new ways of the FDA, the EMA, or our insurance companies, whether it's the NHS or Blue Cross, to pay for and value new innovations. And some of these things are basic. The point was made earlier that technology only plays a role in about 15% of our outcomes. It's our social determinants, our connections, our access to clean water, good food, good social constructs. That's our Maslow's hierarchy, which of course in today's world has new needs. And my most important need today, of course, is battery life. Someone can solve that and we'd be set. So of course, we want to reimagine, disrupt. Everyone's favorite example maybe used to be Uber, right? Only a 10-year-old company, just went public. Companies like Uber are exponential companies. They didn't invent the smartphone, GPS, online maps, online payments. They connected the dots. I got the Get Taxi app here, or Taxi Me, similar model, right? People want to Uberize everything. Human Uber, developed in Japan, provides a way to attend events remotely using another person's body. It's surprisingly natural. So next year, you'll come to Webit, send your human Uber, right? And even Uber's doing healthcare now. You can press a button on the Uber app and have a nurse come to give someone a flu shot, or bring a doctor or nurse to your home, or deliver your drugs. So this pressing the button, getting what we want when we want it, is starting to infuse in healthcare. And big players are coming. Amazon, Microsoft, Google, all moving into healthcare, maybe soon to be delivering your drugs by drone. No kidding. Okay. So this means change is coming. It's here's the drone already approved last month by Verily company. So it means change is coming. It means for the pharma companies here, and it's no longer going to be one-size-fits-all blockbuster drugs. It means, we're going to see massive changes, just like many of these companies have been disrupted over the last 10, 20 years. Kodak, they actually invented digital photography, but they weren't thinking exponentially, so they fell off the map as digital photography got better. And 12 kids down the street from me in Palo Alto sold Instagram for $1 billion. So when no one wants to be the next Kodak or BlackBerry or Blockbuster, you basically want to be Ubering yourself before you get Kodak. So just remember that, and that's your theme for the future of medicine. So I've been lucky to be, and the lights out, I've been lucky to be at this sort of intersection of technology as the chair of medicine at Singularity University since I started 10 years ago. And part of the theme of Singularity University is educating everyone on what's happening in AI, robotics, 3D printing, nanotech, genomics, and beyond. And from my angle, how do we leverage those to impact health and medicine? And because healthcare is a team sport, it's not just led by doctors or pharma companies, we need new minds to come together. So 8 years ago, I started a program called Exponential Medicine. We've grown exponentially. And every fall, we have some amazing folks like Shafi and others come together on the beach at San Diego to see the cutting edge. To taste the new technologies, to help connect the dots and be inspired by and learning from others. And what's important often is not the technology, but the mindsets. This is Tony Young, the head of innovation from NHS. He shared this old quote: "The difficulty lies not in the new ideas, but in escaping from the old ones." And I think we're all sometimes stuck in old ideas, even if you're 20 years old. So we need new ideas and new mindsets to take these technologies forward. And that lots of content and information at exponentialmedicine.com. Hopefully some of you can join us this November. All right, let's look at 4 areas quickly and where they are. Health and prevention, right? We know our genetics are important to our risk for disease, but it's really our behaviors over time that give us the most challenges. Bad diet, smoking, stress, too little sleep, which I have right at the moment, lead to most of our chronic conditions. And it's only been 10 years that we can really start to measure our behaviors. 10 years ago was when the first Fitbit launched. How many people here are wearing a Fitbit or something like it today? Just curious. How many have one in their drawer? They lost the charger, right? Anyone ever been prescribed a wearable by their doctor? Nobody, right? Well, what's going to happen is pretty transformative. These sensors that started as accelerometers are moving to sensors that can be inside our pills, to be in digital tattoos to track our vital signs. We can use a simple technology like a Fitbit to track is someone walking more or walking less after a surgery and using that to impact their care. And where we're going with this is moving from quantified self. A lot of us are data geeks and have the data to ourselves. We're moving to quantified self, where your doctor, your healthcare system will be connected with this information to optimize your wellness, your longevity, do an early job of diagnosis, and then doing much more feedback loop therapy. So let's look at some examples of what we can measure today. Of course, you have a digital scale. Now you can not just track your shape or weight, you can track your shape, whether you want to or not. You can scan your body, how much muscle mass or fat mass do you have. Might be interesting for your medical therapy. You can track blood pressure in new ways. High blood pressure is the #1 leading cause of early death and morbidity around the planet. Well, now you can get a connected blood pressure cuff built into your watch band. It just came out in January. So new ways of doing important data. And blood pressure cuffs will soon go away. I know 3 or 4 startups building radar-based continuous forms of blood pressure monitoring. So we're going beyond just sensors on our wearables to the idea of insidables and contact lenses and chips underneath our skin in ways we can start to connect data real time with patients anytime, anywhere. All right, let's skip this. All right, so what else can we do? We can do some interesting things. We can measure our posture. I can put a sensor on my back. If my posture isn't good, it's like my little digital mother. It gives me a little buzz and it'll help me sit up straight. That's useful. Posture, right? That's a trainable. Some might need a shockable. That will change your behavior. Hearables that can play music but also track your activity. Ringables, a Fitbit on your finger that can track sleep. Sleep is not something we're getting at Webit. It's so important to your health. And there's some amazing new technologies to manage your sleep wherever you are. So try that out at the break. Breathables, they can take your breath. Maybe you're going to go on a date. You want to check your breath, but also pick up signs of early cancer. We're sockables, someone that might have diabetes and they can't feel their feet. Underwearables, that's my new favorite. I won't show you mine, but I have a sensor now in my underwear band. I have like a pack of 10 of these devices, and they can track your breathing, your respiratory rate, your steps, your heart rate. And what's interesting now is Medicare in the United States is starting to pay for these devices to track patients with respiratory issues, with lung disease. So they can get paid for using these as sensors. So the incentives are starting to align with the Internet of Things. The most important drug is arguably your food. You can start to measure your intake and measure your output. Lots of data there, really lots of information. I know 5 startups in that space. So speaking of diet, there's all these fad diets. We're starting to learn that your microbiome, your genome, your blood sugar data can be used to personalize your diets and hopefully treat obesity or diabetes. We could start to measure the health of our children with cameras using artificial intelligence. No sensors at all can pick up heart rate and respiratory rate in the crib. Or using cameras again to see the health of folks aging in place. Is that person drinking, hydrated? Are they dressed? Have they had a fall? So we're entering a time when even Wi-Fi can pick up our vital signs. And so the implications of this are that pretty soon our digital exhaust, our digitome, is going to be collected 24/7. What are the implications? What does that mean? How do you make sense of this information? Our insurance companies may want to charge us differently if we're walking or not walking. So those of you who are looking for a new startup idea, try this. People pay me to put steps on their Fitbits. Whole new business opportunity, right? But the challenge, again, is all this data. How do we make it useful? How do we align the incentives so I can prescribe a wearable blood pressure cuff? How do we integrate it into the workflow of the overwhelmed physician or nurse who's getting burnt out by too many clicks and too much data? How do we integrate this now in our smartphones and flow it to our healthcare system? It's starting to come together, and that can empower each of us to use our information and share it in new ways. And how we use that information for a millennial versus a baby boomer needs to be different. We need precision interfaces, not one size fits all. Now that we're collecting all this data, how do we make sense of it? So Verily, Google Health is doing projects with Stanford called Google Baseline, 10,000 volunteers sharing their digital data and exhaust so we can learn what that means. And where that hopefully takes us is to an era of predictalytics. We can measure our digital baseline, our resting heart rate, our sleep, and find issues before they're a problem. Kind of like our modern cars have a check engine light to give you early warning. And increasingly, it's not the sensors that are important, but the software layers on top that give the power and the value. Okay, we have all this data. We have the knowledge. We need to exercise more and eat less. But that doesn't mean we're going to change our behavior. Behavior change is hard. What if we had a personal coach? It was an AI avatar. It feels real. It matches our personality. These are going to help coach us through health and disease. We're going to see voice become a very powerful platform. Alexa, help, I've fallen, I can't get back up. Lots of health is going to be managed on our voice platforms. Let's skip this. We'll talk to our coach in the mirror. It will give us our health score and give us personal nudges. If you're a smoker, what if it could give you a nudge and show you not you of today, but you of tomorrow? A lot of people here in Eastern Europe, they still smoke. That could be a powerful level for change. Or if you spend too much time on social media, it can be a change. So this is an example of this convergence of augmented and virtual reality. I have my very antique 5-year-old antique Google Glass, right? These were not a great hit from the consumer side, but they have a lot of applications for doctors to use them in interesting ways. Or HoloLens 2, which is coming to market. Really powerful new technologies that Shafi and others are pioneering to leverage into the healthcare space to enable us to see data as clinicians or patients. Or if you're a patient, to see through your body, to understand your basic anatomy and your basic physiology. Even my son Leo now knows at 3 years of age his basic physiology using this sort of technology. So this is very powerful. We can use this for behavior change. I love lessons from aviation. Since I'm a pilot, I spend time in the Air Force. So what if we use lessons from aviation? The heads-up display, right? We see the fighter, where the fighter planes are. The plane could talk to us if we're about to hit a mountain. It tells us to pull up. What if we use that for behavior change? You'd see your breakfast in one way, then maybe another way, and then get a little nudge, right? All right. So then there's virtual reality. Lots of work happening in virtual reality. It feels real, right? Grandma on a roller coaster. But VR is now being used for treating pain. You can go into a cold environment and throw snowballs. It can be used for physical therapy to make it more fun and more engaging. It can be used by patients who are stuck in a hospital and lonely, and they can be at the beach or not scared while they're in a procedure room or having a surgery. And then, as Shafi has pioneered, now we can use this to leverage ways to educate surgeons around the world. I was lucky to be with my brother from another mother, Shafi, at both Exponential Medicine and in his operating room 4 years ago, where he did the first live stream virtual reality surgery to more than 5,000 medical students around the world. He'll talk more about that later. Very powerful. So we're going to change the way we educate doctors, nurses, each of us using these tools. It's an exciting time to bring gaming technology into healthcare. What about the future of diagnosis? We want to pick up disease at stage 0, not at stage 4. Well, now we have a lot of new digital tools to start to measure health and disease outside of the clinic. TytoCare out of Israel is a home health kit that's being sold in Best Buy stores in the United States now that you can use with telemedicine calls so the doctor or nurse can look in your ears and eyes remotely. We now have the advent of the Echo stethoscope. It's an AI-powered stethoscope. It listens to your heart, also does an EKG, and the AI engine does a much better job than me at diagnosing heart murmurs. Or now you can get a home AI consumer ultrasound device that's powered by artificial intelligence, and that can be used anywhere in the world to let a nurse in rural Rwanda do better care, for example. So tremendous opportunity in that regard. And then EKGs on your watch are now starting to be used as that check engine light. 2 million EKGs a month are being done on this platform. So what are the implications? We can now live stream an intensive care unit level of data. How do we make sense of that? It's not just vital sign data, the lab on a chip. You can now have a little connection to your phone and plug this in and do basic laboratories in the privacy of your home or clinic. Or we're seeing the advent of the medical selfie. You don't need to go to the lab at all. Let's say you might have you think you might have a urinary tract infection. Now you can take this device, you can buy it in Boots and Walgreens in the United Kingdom, dip it in the privacy of your own home, use our exponentially more powerful smartphone camera, and it does the diagnosis, sends it to your doctor, who can send you the antibiotic. So much more seamless, easy ways of doing care. What about genomics? I'm not sure if anyone's here been sequenced. The price of sequencing has dropped at twice the rate of Moore's Law to basically under $1,000 today. I've had my genome done. I've had my own socks made personally, very personal socks. That's fun. But we can use this genomic information in powerful ways to predict what drugs will work for us and not for other people, or to understand disease at the genetic level. There's not one type of diabetes, but at least 3 types of genetic type 2 diabetes. We can use that information. And beyond the genome, I'm going to skip through this. Beyond the genome, there's the microbiome, the bugs that live on our skin and our gut, play a really important role in everything from obesity to inflammatory bowel disease to mental health issues. And we're learning that you can measure your microbiome, understand what that means, and then potentially even manipulate that, understanding its role in disease and optimizing our health. So it might not be science fiction. In a few years, you'll get a microbiome transplant, a poop in a pill. Not sexy, but coming. All right. My time is like stuck at 10 minutes, so let me know how much I have. All right, last 2 minutes. We need to connect the dots, right? This is a lot of information. It's overwhelming to even the best clinician. No one can put all this data together in their heads. The doctor of today hasn't had our brains have not had an upgrade in 2 million years. Our devices get upgraded every month. How do we make sense of that? Well, of course, artificial intelligence. We heard from IBM Watson earlier. It's not just AI, artificial intelligence, but IA, intelligence augmentation, to enable each of us to be our own dermatologist or a primary care doctor, to be a specialist. Take a picture, is that a melanoma or a mole? Or, and there's apps that can do that today for free. Or radiology can now be augmented with artificial intelligence. It's already being FDA approved. Or pathology can be done, not to replace the dermatologist, radiologist, or pathologist, but to augment what they do. Amazing work from DeepMind can look at the retina of your eyeball with your smartphone and start to predict your risk of certain diseases. So it's a pretty amazing time where we can democratize these tools almost anywhere on the planet, and even build our own digital twins based on our own data to predict our health and manage our risk for disease and therapy. So again, it's not about human versus robot. It's not going to be doctor versus AI. I think it's going to be the AI won't replace the doctor or nurse, but the doctor who uses AI will replace those who don't. So it's a combination and a blend. Finally, therapy. Lots happening in the therapy space. Gene editing is getting exciting. Lots moving very quickly in that era. We're using now virtual visits. A lot of your care can be done virtually through a camera or a chatbot. Chatbots like Ada or Babylon are already to market. So you'll talk to them first for triage before you go to the clinic or talk to your doctor or see them in person. And our visits will start to feel real using these technologies. Again, you'll feel like you're with your clinician in real time. We're starting to prescribe apps for diabetes, for smoking cessation, for hypertension. There's so many of these that I've just started to curate them all together on a new website you can try called digital.health, that's the domain. And from there you can find a lot of these new tools and technologies that you can prescribe for certain conditions and certain apps. So that's a place we're trying to put that together. Finally, another area moving exponentially is 3D printing. You can print a prosthetic, a hearing aid, your braces. You can start to even potentially 3D print a heart. But you won't want to 3D print a heart if you could instead, which is pretty challenging, modify the heart of a pig. We're starting to use gene editing to knock in human genes and knock out pig genes. And if you're on the waiting list for an organ, it might not be kosher, but you'll take that organ. I tell you, it's coming soon. All right. And one project quickly that I'm working on is to replace the pill bottle into an era where we might 3D print our own pills. Imagine a pill that was based on you, built for you, had the combination of meds that actually matched your physiology and your genetics. So we built a prototype printer that will basically print your pills based on your data It might even print out that pill every morning. Here's the printer. So you'd have your pill, modify it day to day, and eventually print that at home based on your needs going forward. You can watch my last TED Talk on the details. Okay, so lots of opportunity for all of us now to catalyze the future, and that includes being part of a clinical trial. You can now download a clinical trial. You can start to donate your data. You can reshape healthcare by being part of the system, because the future of medicine will be as different as driving is today. You know, remember we used to use paper maps? Now we use Google Maps and Waze. What if we could build a Waze for healthcare, integrating our trajectories and sharing that in powerful ways? And thinking of ourselves not as organ donors and blood donors, but as data donors. So as we move into this exponential future, it's no one technology, it's this combination. You need to be thinking not just where we are today in Bulgaria in 2019, but skate to where the puck is going to be. Things are only accelerating. The next decade is going to be incredible. We all have an amazing opportunity to think exponentially, not linearly. The future really is already here. It's just not evenly distributed. It's in my pockets. So it's our opportunity not to predict the future, but to boldly go forth and create it together. So let's go do that. Thanks very much.